You need your reader. That's something.
Welcome, everybody. Just a second here. All right, welcome to CNS Connect webinar series. My name is Amy Smith, and I'm the Director of Certifications for the BCNS and the ANA. And Megan and Ashley are joining me again today. They are going to talk about how to collaborate with a patient's other providers to gain referrals. So this is something that comes up a lot with questions, especially newer CNSs are wondering how to build that referral network. So they're going to share their expertise today on that topic. As a reminder, if you're a CNS, you will earn 1 CE for today's presentation, and I will put a survey in the chat the last 5 minutes or so of the webinar so that you can claim that certificate. If you have questions, feel free to use the Q&A or the chat throughout the presentation, and we'll keep an eye on it. And towards the end, if there's questions that anyone wants to say out loud, we can unmute you so you can raise your hand. So let me introduce Megan and Ashley. Megan is an experienced functional medicine provider, CNS, research writer, public speaker, and educator with over 10 years in the field of nutrition science and functional medicine. She is the co-owner of BioLounge, a functional medicine clinic in Portland, co-founder and product developer of Florisopy organic soluble fiber blends. And in her clinical practice, Megan works with patients across the country, identifying and resolving underlying nutrition, infectious, and inflammatory triggers leading to the reversal of chronic and systemic symptoms while promoting health and longevity. She combines an extensive health intake alongside comprehensive lab testing and in-depth patient education to improve immune function, reduce inflammatory factors, optimize metabolic function, and reverse symptoms and disease risk. Ashley is a functional medicine provider, a CNS, and an educator who works with adults, teens, and children. She provides care in person and is the co-developer of The Study Hall, which is a workshop to empower and educate teen girls on how to own and prioritize their personal wellness. In her clinical practice, Ashley works with clients to identify and address digestive issues, inflammatory triggers, nutritional deficiencies, gut health, and immune health to reverse their chronic disease status and symptoms. Her passion lies in identifying inflammatory triggers, addressing biochemical imbalances, reversing autoimmune states, and mitigating autoimmune events. She utilizes evidence-based lab testing and an in-depth intake process, and her ability to make personal connections that allow clients to feel seen and heard in their chronic disease story. Megan and Ashley co-developed the BioLounge Clinical Immersion Program, which is a 12-week course built to bridge the gap between education and clinical practice for master's level nutritionists while providing CNS supervision, community, and functional medicine experience. So Megan and Ashley, I will let you take it over from here.
Thanks, Amy. Let me get our screen share going here with you. Hit this one. Yep.
Perfect.
Can you see it all?
Yeah.
Okay.
Yep.
All right. Here we go. Okay. Hi, everybody. We, as Amy shared, we're both practicing CNSs. We are in a constant awareness around the importance of building our relationships. And we know that, especially when you're first starting out, this is one of the most important things you can do, and also one of the most scary and challenging things you can do. So we thought this might be an interesting topic to speak on today and tell you a little bit about how we have developed these relationships in our own practice. I think we've talked enough about ourselves. Yes. Yep, you know everything. Amy. Okay. Great. Okay. So this quote, I think, frames the relationship, the importance of the relationship with other providers. It's teamwork begins by building trust. And the only way to do that is to overcome our need for invulnerability. So building these relationships are scary. They take courage, and you have to get over the insecurity of reaching out, and also the chronic imposter syndrome that comes with doing this job. So we just want to make sure that you all know, we know that exists. We feel it. We are experiencing it, and we have to do it anyway. So how do we change the screen there? There we go. Okay. So this is a story about two different physicians that I have had interactions with. I thought this is, the truth is that you're not going to win everybody's approval or respect. So let me tell you about two different doctors that I have worked with. The first one I reached out to because I work with a family that uses a concierge physician. So they're paying this gentleman $2,000 a month for concierge primary care for their entire family. And that's a pretty cool service because anytime they call, they get an immediate response. If they end up in the hospital, he shows up. So needless to say, he's closely knit with their care. And we did some peripheral testing and found out that they needed some treatment with regards to their gut. So I thought, well, this will be so great. I'm going to reach out. I'm going to tell them what we found. Obviously I'm not a prescriber, so they needed some prescriptions. I'm going to share the results. I'm going to share the research. I'm going to talk to him. We're going to collaborate. It's going to be fantastic. And he's concierge, so he's going to call me back because he has time to do that. And that turned into a 4 or 5 phone call discussion that was followed up by multiple emails where I was providing research to substantiate my perspective. And it ended with him saying, no, I still don't want to do it. No matter what your tests say, no matter what your research says. And because we are fortunate enough to have in-house providers at BioLounge that are prescribers, we ended up being able to still provide the care. But this provider does not refer to me. This provider, I'm not even sure likes me. So I lost him, right? He's not going to be a person that I'm going to work with. We have differing approaches. On the other hand, there is many doctors, but let's talk about one that has worked out really, really well that's in primary care as well, because this is primary care is very challenging to kind of win over onto your side based on their time and their ability to sort of stay up to date on functional stuff. So this is a provider that's primary care that I've spoken with. We've shared a couple of patients, and he said, here's the thing. I don't have the time and the ability to look at their lifestyle factors, but you do. So if they're willing to see you, if they're willing to pay cash, it would be really helpful for me to have you do the deep dive and then provide those details to me. That's a completely different experience, right? And so I now know he's a phenomenal primary care that I can send my patients to, because again, hard to find. And then he sends people to me when it makes sense. Completely different experience. And he may not always be comfortable with prescribing. I've had him tell me, I'm not comfortable prescribing this thing that you found. And we still may have to prescribe in-house, but the relationship's very different. So why don't you talk about setting the stage, Ashley?
Yeah. So one of the key things is figuring out how to build these relationships. And so in our intake process, we're really conscious of getting a sense of who our clients are working with. So they're coming in and we treat a lot of chronic symptoms, chronic disease. And so they've been to a lot of providers and different people trying to help them navigate the symptoms and things they're encountering. And so in the intake form, really trying to understand who are their physicians, who are they working with, who's currently giving them care. And then as we're going through the intake process, really asking questions, someone might mention, oh, I worked with this person, I was doing some sort of therapy. Well, who were you working with? Can you tell me more about them? So that you can really gather information about the physicians, the other naturopaths, the trainers, the acupuncturists, the massage therapists, anyone they're working with. You want to know who these people are. And then you also want to get their permission to really be able to collaborate with those other providers. And we all have our skill set. So I think what we also recognize is that these other providers have skills that we don't have that are improving our clients' state. And then we have skills that they don't have. So asking permission to connect and collaborate and talk about their case, and get a different point of view and understand what their other providers are seeing. And make sure you communicate to your clients. Like, I'd love to collaborate if they're open to collaborating. For us, there are times other providers do not want to collaborate, but we let clients know on our end that we're always willing to put in the extra time and to collaborate. And we really want that data. And many of those times we've gathered that in the intake process, we've built relationships with those other providers that have become great referral sources for us.
I think that's, it's an important point that what we're not saying is reach out to a client's other team members and say, hey, I'd love to use you as a referral source. It comes from a genuine place of wanting to support the client or patient together. That's what breeds this referral relationship, is that mutual desire.
Yeah.
Okay, so now you've collected the data about who this client is working with, and you want to share data. And so you want to make sure that you, I have a typo there. Sorry about that, guys. You want to make sure that you get permission in writing. You want to make sure that everybody's HIPAA compliant, and then you need to identify how you're sharing data. And so this is something that I typically will reach out to the provider and say, I have labs or chart notes that I want to share with you. What's the best way for me to get these to you? And if they have a HIPAA compliant email and I do have a HIPAA compliant email, that tends to be the easiest way to do it. So you don't have to go through your EMR, and faxing fails a lot of the time is what I have found. And then you have patients calling you from their doctor's office saying, my doctor never got this information. But figuring out the most efficient way to do that and stay within, confidentiality is really important. And then if you are looking to build a relationship and you haven't had a direct conversation, include a cover letter. So don't just send, and it doesn't have to be long. It's not you're not applying for a job, but, your chart notes and your labs or whatever documentation you're sending over, and then a quick note that says, I have a desire to connect with you in one way or another. So they know you're not just sending it for their file, but you're asking for that discussion. It's really hard for certain providers to find time to do that. Primary care and specialists in the medical field struggle to carve out that time. They just don't have it. So you have to be really direct about your ask and why you're asking them to give you 5 or 10 minutes of their time. And then ask for the actual time to connect. Sometimes you'll do that directly, and sometimes you'll do that through, their office manager or something.
So asking for help. So I think this is one of the places where if you're dealing with complex symptoms or complex cases, it's really good to ask for help and get others' insights. So when you're working with other providers that are caring for your patient, like sharing your concerns, like, here's what I'm noticing. I suspect my client has a lot of inflammation that has been driving a ton of the symptoms they're encountering, and I really want to help them deal with this. Share your intended approach. Like, what are you trying to do with this client, and ask them to do. Ask for feedback. So maybe they've been working with them longer. I'd love to know what you've seen over time. Like, is there anything you would do differently other than the approach I'm thinking about taking? And just asking for the support and getting the feedback from these providers and learning from them. So one of the ways we do this often, we have an acupuncturist that we refer out to a lot. We do a lot of women's health. And we send clients to the acupuncturist. The acupuncturist sends a lot of clients to us. And given her background with acupuncture and using herbal remedies, like we have different perspectives, the way she explores the body and understands the body. And we have a lot to learn from her. And so often we will have a conversation about what she noticed. And she brings up things that are within our wheelhouse sometimes that we haven't even considered, because sometimes when you're sitting in a room and you only have 75 minutes, there's things you're going to miss. And so it's nice to talk through clients and cases and really understand her perspective so that we can really offer wraparound care, and figure out what else there is to know about these clients.
The ask for help method of reaching out to a provider is a way to engage them with you and also go in with humility, right? So these relationships can feel really easy and they can feel really hard. And it probably depends on the person's position or their background. Some of the harder relationships are medical specialists. And I've had many experiences where they don't care what I have to say. They make it very clear they don't care what they have to say. And when I ask for help, I want to make sure that whatever I'm doing with this client is supporting your end goal with your patient. What do I need to know in order to do that? It immediately disarms them. You become a support to them and a help to them instead of somebody with a competing interest. You might have a competing interest. You might not even agree with what they're doing. That happens. And the more confident you are in this field, the more you see like, I'm pretty sure this is happening, right? But that's not going to work for creating a collaborative relationship. So I have found that I do a lot of initial kowtowing. Do you?
What do you mean by that?
I just sort of go like, this is your patient. How can I help you?
Yeah.
Versus this is my client and I have my own my own personal direction that I want to go with them. Right. And I found that's really been helpful, especially with like gynecology, endocrinology, et cetera. They feel like they need the time with the client. They don't have the time and they're really happy somebody's helping with the lifestyle as long as you're not stepping on their toes at all. Yeah. Yeah.
All right. So it's a relationship. So there's a back and forth. And so figuring out how you benefit each other. So if you are able to establish a relationship and someone's willing to collaborate and they value your approach, because sometimes you're going to walk in the door having these conversations and they're not interested in your approach. And so you're not going to waste your time on developing that relationship. But if you've established that relationship, now you can really understand like what are the types of clients they're seeing. So I have a relationship with an eye doctor that sees adults and children. And I, had a conversation like, who are the types of patients that are walking through your door and who are the types of patients and clients you like working with? And this eye doctor sees a lot of very complicated cases, a lot of concussion, a lot of behavioral issues. And so understanding who they're seeing, but also who they'd like to see, because this eye doctor had a desire to see a different type of patient and really switch things up and not always see the most complicated cases. So understanding who's walking in their door, who they want to see, and then helping them understand who you work with and what are the types of clients you've had the most success with, or who do you want to work with. Understanding the best way to stay in touch. I think, while we're trying to understand how they like to communicate. So this eye doctor loved for me to come out and have lunch with him. Like he wanted to have a face-to-face conversation. Other providers just want to send messages back and forth over email. So figuring out how to connect. These relationships have led to being invited into rooms, to having conversations with other providers in groups. So figuring out what are the ways they want to connect and stay in touch. And then make sure you send your clients to providers that you actually like their approach. Mm-hmm. So, so many of our clients come in here and they say they don't have a primary care physician. They're in between primary care physicians. They're trying to figure out what to do next. And we know the primary cares that are willing to collaborate and are thinking about lifestyle medicine. And so if we have the chance to refer them out to that type of provider, we're going to do it. Or a lot of the women we see, they don't have the OBGYN right now, or they don't have one they love. And we have a couple functional medicine OBGYNs who understand the work we do, we understand the work they're doing. And so there's your opportunity to build a team that collaborates versus other providers that you're going to refer out to that might not understand the work you're doing and how to collaborate. And so make sure you really use that as opportunity. So many times people are looking for certain types of providers, and now we have this big list and we want to send them and share them with our community that we value the work they're doing.
Another way to build your relationship with providers is that every time you do refer to them, you reach out to them to let them know that this referral is coming. The more interactions you have with the provider, the more you're top of mind, and you're declaring your professionalism as well, right? So if I'm sending a provider, or if I'm sending a client to a provider, typically I'm going to call, or in some cases I'm on a texting basis with these providers, and I'm going to say this client is coming your way. Labs and chart notes are forthcoming. I also think I need to give you a little bit of background. Can we chat for 5 minutes about this, just so you know what you're walking into? That is a lot of interaction for you. And that interaction is you're reinforcing that you're a team. You're reinforcing that you exist. over and over and over. And people, you know, if you can make those conversations very concise, respect their time, right? But if in 5 minutes you can say, this is happening, this is happening, this is happening, this is what I'm thinking, this is why I'm referring to you, let's talk again after you've seen the patient. That's a respectful way to make sure everybody's on the same page, and again, get back in front of them. Okay. So now I'm going to tell you a story about how I developed a relationship with my number one referral source, who's a dentist here in Portland. I had a patient who came in with elevated cholesterol, but I'd seen her for a really long time. And she didn't have a history of elevated cholesterol. So this was new, and nothing had changed that we could think of in her health, in her diet, in her lifestyle, in any way, shape, or form. Because I have a lean towards elevated LDL having to do with the liver being triggered into creating more lymphocytes, I was thinking, okay, well, maybe this is inflammatory. Maybe her immune system's getting triggered since nothing else in her lifestyle's changed. And it's not a family history and other, you know, she's in her 60s at this point. I think we would have seen it come up before. And I said, I don't know. I just feel like there might be something inflammatory or immune going on in your body. Can you think of anything? And she said, no. And left the clinic and called me from her car later and said, you know, I just thought of something. I have been 4 root canals have been identified as having infections in the endodontic tissue. I don't have any symptoms, so it doesn't feel like inflammation, but do you think that could do it? And I said, I have no idea, but if you'll let me call your dentist, maybe he can give me some more information. And so I did. This was maybe 4 to 5 years ago. I called him, explained what I was seeing in the labs. He also had no idea if this could be the cause, but because the patient was willing and because he was super curious, we did labs before she had all of these teeth removed, and a couple of weeks after they were removed once she'd healed, and her cholesterol dropped by 40 points. So we were excited, and then together we were digging into the research, and he is a more holistic dentist, so he's looking at the whole body. And that initial curiosity and that initial teamwork blossomed into a very strong relationship. And it has been, like I said, probably my number one referral source, because he's working with complex chronic issues and people are flying in from all over wanting to figure out what's wrong with them. And he's thinking about the entire body. So when he looks at the mouth, he's thinking, well, what else might be going on? But the relationship stemmed from curiosity and having to get over my own insecurity to call and ask him if he was willing to team up with me. Now, he may not have been, right? If he didn't have that personality of curiosity and teamwork, we were not going to have a relationship. You're going to find these people that are aligned with you and are excited about what could be going on and what their nutrition's telling them and what their gut's telling them, and all the tools you have to assess this person may be a benefit to these other providers. So that story is meant to encourage you to make the call, even if it feels like, why would I call a dentist? And a lot of the relationships Ashley and I have are with peripheral providers. They're with physical therapists. They're with people that are not doing anything like what we're doing, but they're seeing a totally different lens into the person's body. And then it's not really intimidating to the provider, and you're not stepping on their toes because your skill set's 100% different.
So staying connected is a key piece to this. So a couple times a year, just really thinking about who is in your community and assessing that. So I think at the beginning of this year, we thought about who are our biggest referral sources lately, because sometimes we start getting referrals from providers that we haven't even created a relationship with. And so then we start to look at, okay, we're consistently seeing referrals coming in from these providers. And so our team will then reach out in different ways. So we might send, an email or a note or a thank you note or something, letting them know we see them, we appreciate that they're thinking of us and keeping us top of mind for them. So really staying connected and building those relationships, seeing if there's ways you can connect. So for example, we have referrals coming in from someone and we have a monthly meeting. We might invite that provider to come into our monthly meeting and talk to our team and tell us all about their practice. And so we're going to learn all about their practice so we can refer for future clients, but also we're inviting them in so that we all can really get to know each other and they can understand what we do and we get to do an introduction with them. And so keep looking at that list and understanding where is everyone coming from. Sometimes I just send like an email if I got a referral from a previous client. So I have a client who's an esthetician. She sees a lot of clients on her own. I worked with her. It was amazing. And I started noticing she's referring clients to me who are dealing with skin stuff. And so then I send her an email when I get a new referral. Hey, by the way, thank you so much for thinking of me and passing along a client. I hope you're doing well. Like, it doesn't take a lot of time, but you're staying connected and staying on top of mind. We share anytime you have upcoming events, share that with the other providers. So here at BioLounge Monthly, we're doing events. We just did an event on hormones. We did an event on kids' health. We did an Ask Us Anything, and parents came in who had questions about their children and teens' kid health. So we're doing an event coming up on cardiovascular health. And so that's a thing that lots of other providers might want to know about. And these events are free. They can send it to their client who they feel like might have been talking about these things and wanting more information. So letting them know the kind of things you're doing, making sure they're getting your communications, or as services are changing, sharing those. We started doing some new services here at BioLounge, and we have this functional medicine community in Portland. So we might email the functional medicine community in Portland and let them know, hey, we have some new tools at BioLounge that your clients might want to use that they don't have access to at your practice. And then share your clients' results. So, if you're working and referring to other providers and you have started a conversation, there's also like an end to the conversation or continue the conversation. Like, you might have the client who walked in who's now doing really great and no longer having all those symptoms. So send that message. Like, I'm so glad that our client has shown a ton of improvements and made big changes in their life and they're feeling better. Thanks again for thinking of me. And meet in person when you can. If you have the time in your schedule, like having times to have sit downs. Like Megan and I have days where we're like, okay, Fridays I have a little extra time. I'm not in clinic all day. And that's when I'm going to connect with people in the community that we're supporting each other's practices and learning and growing from each other. So setting aside time in your schedule where you're like, this is when I make connections.
And my clinical schedule, and my personal schedule is such that I do schedule coffee dates with providers that are equally busy at 6 a.m. Friday at 6, I'll be meeting with a radiologist. We'll have coffee till 7. And then we both go and do our thing, right? So think outside the box a little bit, know that everybody is battling their schedules. But if this is a priority and whether you're sharing clients or you just want to share updates on what you're doing or how you can support their patients, it's worth the ask. And medical providers are often really willing to do that. They're used to doing that. They're used to working around their clinical schedule. And I think, just them knowing what you have to offer oftentimes is enough. And I do this very regularly, but not with the same person regularly. I probably see all of these providers once a quarter. I have certain people I take to lunch. The dentist, I go to his clinic and I bring in like snacks, healthy snacks, not the cupcakes everybody else brings, but healthy snacks, or I bring coffee to his team and we sit down. Keep in mind that just because the provider knows who you are doesn't mean his team knows who you are. So you have to think about who's interfacing with the client or patient. In a dental practice, it's the hygienist. So you want them to know who you are, what you do, hand them something they can hand out. How do you, if you have a brochure, you have a business card, whatever, but become part of their family, become part of their team. So the more they know you exist and the more that they're thinking about you, the more clients you're going to get from them. And you're going to have to probably make that effort to take the drive, go into the clinic, have the early morning coffee, et cetera, if you're going to try and create those types of relationships.
Also, when you're thinking about that list of providers, it's also, if you have places that are blank, you can reach out to those connections like, hey, I've been looking for someone who does this type of work. Who do you refer out to? And so they can even help you expand your connections and give your clients more options. So I think that's also really helpful.
Yeah. The functional medicine group that we are part of, some of the providers do an awesome job of keeping their provider list. So if we email out like, oh, I need an endocrinologist, there's always somebody in the group that says, here, this is the person I love, or my patients have had a really good experience with. And that, you can trust in the people that you trust in to give you other people that you can trust in. So I thought I would throw this up here because it's a great example.
Yeah.
So we have a relationship with a company called Skin by Lovely. And so this is more of an aesthetics business. And so it doesn't compete with what we do at all. It's not even really totally aligned with what we do, right? Because it's all cosmetics, but it is a client base that's the same as ours. People thinking about their inside and outside. And so they reached out to Ashley and I and wanted to host an event, which is happening tonight, to talk about basically aging from the inside and the outside gracefully. And so they'll have a panelist of two of their providers, which are nurse practitioners, talking about aesthetics things. And then Ashley and I will both be speaking on things you can do from a nutritional perspective to improve your outsides. And so these collaborative events are really fun. We host them. We'll have providers come in, other people host them. It's a way to keep feeding that relationship, and better, it's a way for other clients, potential clients, to meet you through a trusted source that they already have, somebody they're already seeing. Now, I do want to make a note of something from a business perspective. If you are going to be a cash-based practice, which many of you will, these relationships are much easier if the provider or whoever you're working with is also cash-based. There's a hump to get over when somebody that is an insurance-based provider sends them to you and you're cash-based. It isn't insurmountable, but it's a hump, right? So when they're seeing somebody they're paying cash to and then they're sending them to you, it's much, much easier and the expectations are already set, I would say.
Yeah, definitely.
Okay. What specialties complement what you do, right? And what you're interested in. We do a lot of women's health, as Ashley said. So it's helpful for us to have other providers that are savvy about women's health. It doesn't mean that they're a gynecologist, right? But we do have gynecologists that we work with. It's also important that they are in a similar mindset. It would be really hard to work with a gynecologist that didn't think nutrition had anything to do with women's health. If you can get clear with yourself about what you do and what you're really interested in building, it's a lot easier to figure out the providers that you want to energize in these relationships. Because as you can tell based on what we're saying, it's not like this doesn't take no energy. And especially when we started out, it took a lot more energy to build these relationships. It's more streamlined now, but it's a huge commitment.
It is. And I think, a good example of this, so women's health is a priority for us and it's something we do a lot around. And so for me, one of the priorities was OBGYNs who do what we do. And so I personally wanted to know who was in the Portland area and I went to see them for care. Yeah. I saw several of them. Because I wanted to really know, it might say functional medicine on their website, but who actually really believes in this and practices it in a way. And I dated a few OBGYNs and then I found the one, and that's the one I refer my clients to. And I found others that weren't a great fit. And so I think even if they say things on their website, like really getting to know them, I don't recommend like visiting 10 OBGYNs to find the one, but just really understanding the experiences people are having with them. Because we do, for example, we have one OBGYN who understands what we do, we refer out to them. And then we have another who understands what we do, but it's not as positive as a relationship. And they send clients to us, but then they sometimes challenge us and it becomes a really difficult relationship. It seems like they want to collaborate, but they don't. And so that is not the OBGYN I send my clients to, because I'm not interested in a really intense collaboration. I want a really positive collaboration where we're both helping the clients. And so I think really thinking about who's out there that complements your care, but also having conversations or getting to know them or clients' experiences with them, because just because their website says it doesn't mean they believe it. So getting to know them as providers in some capacity.
Yeah. And to add on to that, it's also interesting. I'm thinking about an OBGYN that I developed a relationship with who doesn't know anything about what I do. Like she's interested, but she really doesn't know anything. What she knows is that she doesn't know anything. And that's equally valuable. So she's not going to try to have competing interests. She's not going to step on my toes. She does send patients this direction because she says, I can't do this kind of stuff, but I think it's really important for you. We know that being overweight at a certain point increases your risk of female-related cancers. I think you need to get this under control, and I think you need an assessment, right? But I'm not going to be the one to do it because I get 7 minutes with you. That sort of a thing. Those are really valuable relationships too. You either need somebody that has the experience in what you're doing and believes in it, or somebody that believes in what you're doing and doesn't have the time to offer it or the experience to offer it. And both of those can really build your practice. Oh, we forgot. How'd your slide? Okay, wait. We have one more story. Ashley needs to tell you because it's really important.
I'd say so. I wanted to share with you one of my greatest referral sources. So one of my greatest referral sources was a woman I looked up to in childhood who was older than me, and she went on to become an OBGYN. And she had a very separate life. I didn't know what was happening in her practice, but I was curious what she was doing. So I reached out. I was following her practice. I stayed connected with her. And we were hosting an event around hormones and educating clients who are experiencing perimenopause or menopause around all of the tools that exist for them in terms of hormones and how to help them with the things they're encountering. So I invited her to that program, and she ended up signing up and doing our educational events around hormones. And just because she's an OBGYN doesn't mean she knew much of what we were teaching. And she came to our course and learned so many things. And she was so grateful that I invited her. And that was her first introduction to me, no longer this little kid she knew running around, but me, a professional doing work around women's health. And so she learned a lot from our entire team, and then ended up signing on to become my client, and then signed her kid on to become my client. And then we got to work, and she got to see my personalized approach. And from that moment on, she was hooked and fascinated by lifestyle medicine, understood she couldn't do all of it in her practice, or she didn't have the background. But she became my best referral source, and she sends me clients all the time. And it's been amazing. And now she's gone on to study lifestyle medicine, and she's learning all of these things, and she's interested in functional medicine. But just inviting her to that event where she's going to learn something, like, don't assume because they're an OBGYN, they know everything about women's health, because they don't. And she would tell me about the things that she didn't learn in school. She didn't even understand how estrogen exited the body properly when it becomes toxic. And so she was so grateful to be able to learn, connected with our work, and now sends patients here and feels really comfortable and confident that they're going to get the care they need. And so that's definitely by how I got my referral source. So invite them to your events or education, or do educational content for people that you believe could value from this work. Even if they're not functional medicine or believe in nutrition, they might convert and become believers.
And I don't know that you said that she's in Alaska, which is even crazier. So Ashley's just getting constant clients from Alaska, so don't, know your state laws, but open up your boundaries, because you can work remotely in a lot of cases. I mean, we work with people all over the country that are being referred to us from all over the country. And Ashley just said something that we didn't talk about, and I think it's important. I did this so much when I was first starting out. I would have these little relationships that were sort of budding relationships with providers that had a lot of patients that maybe had metabolic issues. And I would say, hey, I am happy to create some content for you. Do you want a handout that talks about, like 5 easy steps to balancing blood sugar, or 6? I had one called the 6 S's, which is now retrospectively kind of funny, but it was 6 different ways to get more vegetables into your diet, with smoothies, soups, snacks, sides. There are 2 others that start with an S. And I would make these little beautiful handouts branded with my logo and all of my contact information for free for the provider, for them to hand out, and then give them my business cards. And this was a way for them to provide a resource they didn't already have to give to their patients. And a percentage of those people would call me and want to work with me. So, you have to give up some of your time in the beginning to build these relationships. We still give up some of our time. But it made me think, one other thing, we talked about doing collaborative talks. I offered a lot of talks at people's clinics that weren't collaborative with them, but they were for their patient population. Or I think I've said this before, in our talks with the ANA, but I spoke at Orange Theory. I just would throw myself into any position, any situation, any business where there might be like-minded clients thinking about health and lifestyle, and then think of something provocative to talk, evidence-based, provocative to talk about. And it built relationships. So I just think, throw yourself out there in whatever way you can, and be creative with it.
We've got a couple of questions. And maybe you can tell, this will maybe spur some conversation, but Laura's asking about the coffee dates. Are they productive or are they friendly? So maybe talk a little bit about what your goals are when you set up those coffee dates.
So almost always, there are going to be some mutual clients or patients that we're going to talk about. I got a text message yesterday from a provider that said, "Hey, can we grab coffee? I've got 2 patients I need to talk to you about." Now, I also know his dog's name and all of his kids and what's going on with his wife, right? So they're not mutually exclusive. We're going to talk about the patients. That initially is a great way to ask for that coffee date when you're just getting to know somebody. Like, I'd really love to talk these through with you in person, if you have time, but they're personal too. And we have, great relationships because of that.
Perfect. Melinda's asking, if the only way a practice will let you share info with them is to buy all the practitioners lunch, would you do that? The two most complementing in practices in my area are both insisting on that being the way to get an introduction to the practitioners.
Whoa.
Interesting one.
Whoa. Yeah.
I guess the question would be, how much do you believe they are going to become a referral source?
Yeah.
Like, are they really aligned with what you do? Do they seem to have the client base you're really looking for? I think that's the key. Like, maybe I would make that investment if you really believe your clients are on the other side of that. And do you know anything about their history to actually build those relationships? Like, are they looking for a lunch for their practice, or do they actually value the relationships they have? And so if you can get any kind of connection to people that really have worked with them or collaborated with them, that would be helpful. It is an investment. Yeah, that's.
And I think a lot of medical practices are used to pharmaceutical reps and even we have supplement companies that bring us lunch. That's really common because it's a return on investment for them. The biggest question that you're going to have to answer, is it a return on investment? So if it costs you $200 to bring in, and you better bring a good lunch, right? You're a nutritionist. Don't bring McDonald's. So it's going to probably be more expensive. But if you're going to bring lunch, then you need to make sure that, it probably means you need one client in return, right? For that to be a return on investment. I probably would do it if I felt like it was that important. Now, I will tell you, I've gone into clinics and spoken, like, for instance, to a group of OBGYNs. I was not required to bring them food. But I made sure that I had enough time allotted that I got to speak to them about what I do. I had handouts. I had a bunch of stuff to leave behind because I wanted to stay in their face. Then I followed back up a couple weeks later and left a little gift basket with my fiber product to get back in their face. So I would say you need to make sure that if you spend that time, you've got a strategy around being front and center, and that you leave them stuff and you leave a good impression that you're going to be able to support their patients.
Perfect. All right. Next question says, when you create those helpful handouts for clinics, do you co-brand them with that practitioner's information, or is it just yours?
I've done both, and it depends on what they want. So some practices will just keep our BioLounge trifolds and cards in their clinic, and then they'll have handouts from me, and they give all of it because they don't want to do any of it. They're not trying to act like they know anything about what we're doing, but they are endorsing what we do. With the dentist I work with, I've created an entire treatment, pre-procedure treatment protocol for him with food and supplement recommendations for every patient, and that's co-branded with him. So it's kind of a work in progress based on your relationship with them, and you get to, do whatever you feel most comfortable with.
That's all the questions I have, but if anybody wants to raise their hand, we can also unmute you if you have any other questions.
So while we're waiting for that, I can tell you a little bit about how you can connect with us. So there's a couple ways to connect with us. One, we have a free newsletter. That's the learn.bioloungepdx.com/clinical insider. Megan and I share content monthly around client cases we're dealing with, or some of our tools and practice we're using. that can support your clinical practice. We also offer opportunities for you to ask us questions. So if you have a client that you're working with that has a very specific condition or disease and you want to learn more about it and collaborate, you could share that with us. And we're happy to share our experience that we've encountered through our Clinical Insider. We also have our clinical immersion and CNS supervision program. So we have a 12-week program where we dive into functional nutrition and investigative nutrition and really share all of our favorite clinical tools. We have a 10-month program where we supervise CNS candidates if they want to be supervised by us, as well as learn our approach to functional nutrition. So you can stay with us for a really long time. We have month-to-month supervision if you're just trying to get some of your supervision hours in. And if you're curious about all those options, you can go to learn.bioloungepdx.com. And then if you have any questions that come up following up to this content or any of our presentations, you're welcome to email us at learn@bioloungepdx.com. And we're always happy to answer questions.
Perfect. I think we got another question. Any tips about how to approach clinics about doing helpful free presentations for their client base?
Thoughts on that?
I have a couple.
Yeah. I think one thing is, what do you think would be really valuable? And so for me, there's a provider I'm specifically thinking about going after, and they are a pain doctor. And so one of the things I'm really thinking about is like, what is going to be the most valuable thing to him? And so I am gathering like information and data in a presentation to send and say, I really think this would be helpful for you to understand. This is how I work with clients with pain. This is the type of results I've gotten with clients who have chronic pain. And if you think it would be helpful, like I'd love to do a presentation on this topic with your clients. So I think gathering like, what information do you have to share that's valuable, versus I think it can be challenging if you're just like, would you like me to do a presentation on anything for your clients? Like, I don't know, they're busy. They don't have time to think about it. If you don't have time to think about what the topic would be, they don't. So I think it's coming up with something really specific that you think will be valuable to them, getting it in front of them, sharing little pieces of that information, and then asking them for the opportunity. But if you don't ask, the answer is no.
Yeah.
So what is the risk in asking 10 people if you can do a presentation with them and one person says yes and 9 people say no? It doesn't really matter, because that one yes is valuable and really important.
I think you need to think about the type of provider that you're approaching. So let's say that you're asking a private practice provider of whatever type, physical therapist, acupuncturist, doctor, doesn't matter, but it's just them. They're the only decision maker. They're not thinking about other doctors that work with them. They don't have a clinic manager. You want to have something that you send to them that's they're going to be more open, by the way, because they're busting at the seams, bottom line. You're going to send them something probably initially via email that says, I offer complimentary educational opportunities for provider offices. I cover these 3 topics. I offer them via webinar pre-recorded, via live webinar, or in your office, or whatever you're doing, right? I have handouts that go with it that you can keep in your office and that I can send home in these, situations, right? If you're interested in an outline of each of the 3 topics I just told you that I offer, I'm happy to send you an outline. Are you interested? Everything needs to be to them in writing first and be really, really succinct. Then from there, it's, do you have time to talk about this? Is this something you're interested in? Schedule a call. That's an individual provider. If you're talking about a clinical office, they have somebody that works for them typically that schedules those sorts of things. It's normally the clinic manager. It's similar. You want to give them everything in options. This is what I do. This is why I do it. This is how I do it. This is why it's a benefit to you. I'll tell you, that ask is a lot easier if you have some sort of, 6 degrees of separation from the provider, right? My sister sees you, or I share a client with you, or I work with this other provider that you have a relationship with, right? It is easier. But if it's a cold call, you need to make it really professional. You need to make it really clear, and you need to give them options that they can choose from that work for their patient population and the way that their clinic runs. Another idea is pre-recorded videos that you have for people that have certain diagnoses, right? Like, this is my 10-minute video that I share with people that have been diagnosed with diabetes. I covered this, this, and this. that sort of a thing, then it's an educational resource for them. So think about the topics that are most relevant, think about the delivery system, and then think about who you need to be in contact with, and the best way to have that initial conversation and then follow up.
Thank you very much. So we'll give it just another second to see if there's any questions. I put the CE survey in the chat, and we have 2 more CNS Connect webinars this year. Ashley and Megan will be joining us again on November 7th to talk about how to review medical labs with nutrition in mind. And then Clinicians Incubator supervisors Meg Bowman and Allison Rue will be joining us on November 2nd to talk about finding your clinical signature. So those 2 webinars will wrap up this year's series. It looks like no more questions. Oh, Laura's asking, it looks like you have monthly supervisor options. I presume a background with other supervisors is also okay.
Yeah.
Definitely.
Yeah.
And I don't know if you all mentioned this, but you offer CEs as well, right?
Yes, we do offer CE for, yes, our clinical immersion program offers, I believe, 42 CE credits.
Fantastic.
It's like what do you see that, Amy? One more question.
Do you also mention that you don't take insurance, cash pay only within that email when approaching the providers?
No, because what you're asking is for an opportunity to provide education for their patient population. Working with you is, I would say that's almost assumptive, and you're trying to say, look, I'm going to give you this free thing that's for everybody, that's for the community. So if somebody's interested in working with you after the fact, then I would make sure that you provide all of that information, or that might be something that they want to have as a handout, your fee schedule when you do the presentation. But no, I wouldn't bring that up initially. They'll ask if it's important to them.
And then I think we have another question that's specifically about your supervision. They're asking if you all have background in botanicals.
We work with herbal supplementation quite a bit with our patients. Neither one of us are herbalists. Yeah.
Awesome. All right.
Thanks,
Thank you
Amy.
so much. And Laura's asking if either of you will be at the summit next week. I don't think so, right?
Yes, no, not this year. We're hoping next year.
Next year. Yes. I've said to Amy a million times now, I have a senior graduating from high school this year, and I've vowed not to miss one moment of that lived experience with him. So I'm saying no to a lot of things this year, so I don't miss anything with him. I'm disappointed. Can't be in 2 places at once this year.
That's how it works.
Yep.
Well, thank you both. And if any of you listening will be at the summit next week, please come see me at the booth, and I would love to say hi and meet you if I have not already. And like I said, please feel free to register for the upcoming webinars. And thank you both. We look forward to seeing you in a couple of weeks for our final webinar of the year.
Awesome.
Thank you.
All right. Thank you
so much. See you.